Hi, my name is Michelle Buell. I'm a nurse practitioner student. Is it okay if I perform a head-to-toe physical on you today?
Yes.
Okay. And what is your name?
Taylor Buell.
Taylor. What do you like to be called?
Taylor.
Taylor, okay. Nice to meet you. Okay, so first I'm just going to have you do a couple walking motions for me. So if you can just walk normally to the end of the bed. Okay, and then on your way back, we're going to do heel to toe like this. Okay, and then coming back towards me just on your toes the whole way. And then back one more time and just on your heels this time. Okay, and then I'm going to have you stand right here. I'm going to have you put your feet together and shut your eyes. And I would do this for 30 seconds. Okay, you can open your eyes back up.
Okay.
You can assume a normal stance, and then this time I'm going to have you put your arms out with your palms up.
Okay.
And then again, shut your eyes. And I would do this for 20 seconds. Okay, thank you. You can open your eyes back. And then is it okay if I open your gown just to have a look at your back?
Mm-hmm.
Okay. Okay, and then if you can just lean forward for me. Okay, and then you can come back up. And I'm going to come to the front and just help to stabilize you, and we're going to do a couple ranges of motion, okay?
Okay.
So if you can lean back for me, kind of arch backwards. Okay, then come forward, rotate side to side, and then we'll bend. Okay, and then I'll have you take a seat for me. And is it okay if I touch your head?
Mm-hmm.
Okay. Any pain or tenderness anywhere when I'm doing this?
No.
Then I'm going to move on to your face, okay? Is it okay if I touch your face during
Mhm.
this exam? Okay.
Yeah.
Okay. I'm going to have you do a couple things for me. Can you shut your eyes really tight? Okay. And then raise your eyebrows. You can open your eyes back up. Okay. And then frown, smile, show me your bottom and lower teeth, and then puff out your cheeks. Okay. And then I'm going to palpate, okay?
Okay.
So I'm going to be touching your face. Any pain or tenderness here?
No.
And I'm pushing, no, okay. No pain here.
No.
And then that was cranial nerve 7 when we were doing the facial expressions. And then for cranial nerve 5, can you clench your jaw for me? Okay, one more time. Okay. And then I'm gonna feel here. We're gonna move your jaw side to side, stick your lower jaw out, and then open and shut. Okay. And then also for cranial nerve 5, just shut your eyes for me, and then just let me know if you can feel me the same on both sides.
Yeah, same. 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 Same.
Okay, you can open back up. Okay, then I'm gonna look at your eyes. Do you mind pulling down for me? Okay, and then we're gonna test cranial nerve 2. I would hold this 14 inches. You would cover one eye, read the lowest line, and then switch, cover the other eye, and read the lowest line. Also for cranial nerve 2, I'm gonna come behind you and move my fingers, and you just let me know once you can see them, okay?
Yeah. No. No. No.
Okay. And then for cranial nerves 3, 4, and 6, I'm just going to have you follow my finger, but just with your eyes, okay?
Yeah.
Okay, Okay, then I'm gonna come towards you and just follow it in and then back out. Okay? And then with my pen light, I'm gonna look at your cornea and your corneal light reflex. Just look back at me. Okay, and then for cranial nerves 2 and 3, I am gonna shine a bright light in your eyes a couple times, okay? And you can just look at a spot behind me on the wall. Okay, then on the other side. Okay, and then just pick a spot behind me on the wall.
Okay.
And then come back and focus on my finger. Okay? And then we are going to take a look inside your eyes, okay?
Right.
So while I'm doing this, you can just keep focused on the other side of the wall. And you're going to feel my touch here. And then I'm going to come in close. Okay, then we're going to come and do the same thing on the other side, okay? So you're going to feel my touch here. And then I'm going to come and look at your ears. Any pain or tenderness?
No.
We're going to test cranial nerve 8. So I'm going to plug this side and I'm going to whisper a set of numbers and just repeat them back to me, okay?
3, 4, 6.
Okay, then same on this side.
7, 6, 9.
Okay. And then we're going to do a couple things with our tuning fork here. I'm going to place it on the top of your head and just let me know if you can hear it on both sides or one more than the other.
Okay. Both.
Both, okay. And then I'm going to place the tuning fork behind your ear here. Once you can stop hearing that, let me know. I'm going to bring it to the front of the ear and just let me know if you can hear it again.
Okay. Okay, stopped. I can hear it.
And you can still
Yep.
hear it? Okay, we're going to do the same thing on the other side.
Stopped. Yeah, I can hear it.
And still hear it, okay? Then I am going to take a look inside your ears. Is that okay?
Sure.
So you're going to feel my touch here. And just let me know if I'm hurting you. Okay? And then we're going to, is that okay?
Yep.
And we're going to come to the other side. And again, you're going to feel my touch. And I'm going to pull up on your ear. Okay. Thank you. And then I'm cleaning all of that I just used. And then for your nose, inspecting it, we're going to test the patency. If you can plug one nostril and sniff, and then the other side. Okay? And then for cranial nerve 1, I would have you close your eyes and identify sense for me.
Okay.
But I don't have any sense. But that's how we would test it. And then I am going to take a look inside your nose, if that's okay.
Sure.
So we're going to have you, flex back. You're going to feel my touch on your forehead and then on your nose. Okay, and then other side. Okay, thank you. And I once again would clean that. And then for your mouth, I'm inspecting your lips on the outside. I would have a tongue blade, and can you open up for me? And then lift your tongue up. Okay, and then cranial nerve 9 and 10, I'm going to have you say ah. Okay, and then cranial nerve 12, I'm going to have you stick your tongue out and then move it side to side for me. Okay? And then for your neck, we're inspecting, looking at your trachea. We're gonna do some ranges of motion. So if you can put your chin to your chest and then all the way back, and then look side to side, and then touch your ear to your shoulders. Okay, any pain or tenderness when doing that? Okay. And then for cranial nerve 11, I'm gonna have you shrug up against me. Okay, and then turn, and then turn. Okay, and then is it okay if I palpate your neck?
Yeah.
We're gonna feel your lymph nodes, your preauricular, postauricular, your tonsillar, occipital, your posterior cervical, deep cervical, superficial, your submandibular, your submental, and then your supraclavicular. Okay. And then I'm going to go to the back, okay?
Okay.
So if I can have you just
Just shake the
move
mouse, make sure it's
around.
awake.
Okay.
Is that okay?
Yes, and I'm going to feel for your thyroid. So is it okay if I put my hands around your neck on this side?
Yeah.
Okay. So you're going to feel me here. If you can just slightly flex forward and swallow. Okay. Then we'll have you swallow one more time and you're going to feel me kind of moving your thyroid over. Okay, and just relax. And then we're going to do the same thing again, okay? And swallow. Okay, thank you. And then is it okay if I move your gown to the side?
Yeah.
Okay. And I'm inspecting the back. I'm going to palpate any tenderness, any tenderness down your spine.
No.
I'm going to have you take a deep breath in and then out. Okay. And then can you say 99 for me every time you feel my hands move?
99, 99, 99, 99, 99, 99, 99.
Okay. And then I'm going to percuss down your back, okay?
Okay.
Okay. And then we're going to feel for your diaphragmatic excursion. Okay, can you take a deep breath in and hold it? Okay, and then let it all the way out. Okay, and then we're going to do the same thing on this side. Okay, and take a deep breath in and hold it. Okay, and then let it all the way out. Okay. And then we'll have you take a deep breath out of your mouth every time you feel my stethoscope, okay?
Okay.
And then one last thing, just I'm gonna hit kind of on your back here and just let me know if there's any tenderness there, okay?
That's okay. That's okay.
Feels okay?
Yep.
Alright. And then I'm gonna come back to the front. Thank you. Okay. And is it okay if I pull your gown down in
Yeah.
front? Okay. And I'm inspecting the chest and looking at his respiratory pattern. Then I'm gonna feel okay
Mm-hmm.
for any thrills, heaves, or lifts. Okay, and then I'm gonna listen to breath sounds again, okay? First, is it okay if I touch your neck?
Yeah.
I'm gonna feel for your pulse here. And then I'm gonna listen on your neck and then listen down
Okay.
for your breath sounds. And just hold your breath for me. Okay, you can breathe normally and then hold your breath once again. Okay. And then just a deep breath every time my stethoscope
Okay.
moves, okay? And then I'm going to listen for your heart sounds, okay? So you can just breathe normally throughout this exam. Okay, and then I'll just have you lean forward and we're going to listen again, okay? So you can just breathe normally. And then last time. And then we're just going to feel your shoulders, elbows, wrists, and hands and do some range of motion and strengths, okay?
Okay.
So we'll start by inspecting and then palpating any tenderness when I'm doing this.
Mm-hmm.
Okay, and then we're going to do some range of motions. If you can go up and then back and then out to the side and bring them back in. And then we'll do like kind of this, like a hinged door, and go up and down, okay? And then you can put them to your side, try to come up against me, okay? And then bring them down against me. And then for your elbows, any pain, any tenderness?
No.
Any pain, any tenderness?
No.
Okay, and we're gonna bring them up, back down, and then flip forward and back, okay? And then try to bring them up against me, and then push down, okay? And then for your hands, any pain, any tenderness? All this feels okay?
Mm-hmm.
I'm gonna feel for your pulse. And then checking your cap refill and for any clubbing. Okay, and do the same thing. Any pain or tenderness? Okay. And then can I have you make a fist? Spread your fingers out. Come in and go back out. Okay. And then don't let me squeeze your fingers together. Okay. And then don't let me push them apart. Make a fist and squeeze as tight as you can. Okay. And then we're going to check your reflexes. So first I'm going to kind of take you here and just make sure
Relax.
you're totally relaxed. Okay. And then just look somewhere else or shut
Okay.
your eyes, okay? Okay. And we're going to do the same thing on this side. And then just look somewhere else or shut your eyes. Okay. Okay. And same thing over here. Alright, and we're going to turn you this way and kind of let me have the total weight there. Okay, and then once more on this side. And then we're going to come to your knees. And again, just totally relax, okay? You can just shut your eyes or look away. Okay. And just relax. Okay. Then I'm going to come behind you here. Okay. And then to this foot. Okay. And then I'm going to stroke the bottom of your foot, okay? Okay. And one more time on this side. Okay. And then we're gonna test for sensation on your upper and lower, okay?
Okay.
So this is dull and this is sharp.
Okay.
Can you tell the difference?
Yeah.
Okay. So I'll have you shut your eyes and then just let me know.
Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay, we're gonna come to this side.
Sharp. Dull. Dull. Sharp. Dull. Sharp.
And we're gonna do your legs as well, okay? So
Okay.
same thing.
Dull. Sharp. Sharp. Dull. Dull. Sharp.
And then once more on this side.
Sharp. Dull. Dull. Sharp. Dull. Sharp.
Okay, you can open your eyes back up. And we're gonna do a couple things with your hands, okay? So in a second I'm gonna have you shut your eyes. I'm gonna put an object in your hand and just see if you can identify it for me,
Okay.
okay? So shut your eyes.
flex hammer.
Okay, and then I'm gonna put another object in this hand.
2 and 4.
Okay. And then with your eyes still shut, I'm gonna draw a number in your hand, and just let me know what number it is.
8.
Okay. And then on this side,
7.
you can open your eyes back up. And then I'm gonna have you kind of on your thighs, flip your hands forward and back as fast as you can. Okay. And then if you don't mind moving over here, I'm gonna have you lace the pine
Okay.
for me. Do you have my stethoscope? I think
Did I just lay on it?
Oh, almost did. That's okay. Okay. I'm inspecting. Looking at your respiratory pattern. Then is it okay if I pull down your shirt to listen?
Yeah.
And we're just gonna listen to your heart sounds one more time,
Okay.
okay? And then is it okay if we perform an abdominal exam?
Yeah.
Okay. Do you mind lifting your shirt for me? Okay. So first we're just gonna inspect. And then I'm gonna listen to your abdomen, okay?
Okay.
Okay. And then I'm gonna tap on your stomach. Is that okay?
Yeah.
And then once again on this side, okay?
Okay.
Okay. And then I'm gonna touch. Is that okay?
Yep.
Any pain or tenderness?
No.
And just let me know if any of this hurts, okay?
All right.
And then once again, feels okay?
Yeah.
Then we're gonna try to feel for your liver on this side, okay?
Okay.
So you're gonna feel my touch behind and feel me here. And when you're ready, I want you to take a deep breath in for me. Okay, you can exhale And then to feel for your spleen, I'm gonna have you roll on your right side and flex your legs up for me, okay? Again, you're gonna feel my touch on your back. And then when you're ready, take a deep breath in. Okay, and then we'll have you roll back over. And we're gonna feel for your kidneys, okay? So same thing, you're
Alright.
gonna feel my touch on the back, kind of lifting you up. And then deep breath in for me. Hold it. Okay. And then same thing on this side, deep breath in. Okay. You can exhale, thank you. I'm gonna cover you back up. And then like we did up top, we're gonna do your hips, your knees, and your feet to check for range of motion, okay?
Alright.
Any pain or tenderness?
No.
Okay. And then are you able to lift your leg up and back down? We'll do the same thing. And then can you scissor it out and back in? And then out and back in. Okay, and then we're gonna test your strength. So pull up against me, push down against me, out, and then back in. Okay, and then up, down, out, and back in. Okay. And then your knees, any pain or tenderness here?
No.
Any pain or tenderness?
No.
Okay, I'm gonna feel for your pulse. Okay, and then we'll have you just, I'm gonna kind of support you here, just up and down for me. Okay, and then do it against me and against me, okay? And same thing on this side, I'll kind of support you here and up and down on your own, and then against me and against me, okay? Any pain or tenderness?
Nope.
Okay, and can you put your toes towards your nose and then down towards me, and then kind of curve them in and then out, okay? And then up against me, and then push down against me, okay? I'm just gonna feel your whole leg for any edema. No pain when I'm doing any of this?
Nope.
Okay. And then if you're able, I'm gonna have you take this shin, or this heel, and just rub it up and down your shin on this side, okay? Okay, and then we'll switch and we'll do the other side. Okay. And then I'm going to show you first, and then I'm going to have you shut your eyes, okay?
Okay.
So this is up, and this is down.
Okay.
Okay, so have you shut your eyes?
Down. Up. Up. Down.
Okay, and we're going to do the same thing over here.
Up. Up. Down.
Okay, and you can open your eyes back up. I'm going to use my tuning fork again and place it here, and you just let me know if you can feel the vibration, okay?
Okay. Yeah, I feel it.
Then just let me know when it stops.
Stops.
Okay, and one more time.
I feel it. And it stopped.
Stopped? Okay. All right, that concludes our exam. Thank you so much for your time.